Normally every Tuesday, Dr. Escott provides a COVID update for the Commissioner's Court that's available to the public through our CCTV and on YouTube. And today, while we don't have Commissioner's Court this week, I know you all rely on the information that is shared to make important decisions about how to stay safe. And so that's why today, to provide our Travis County COVID update, I'm joined today both by Dr. Mark Escott and Dr. Shailaja Hayden. I want to thank both of you for joining us this morning. Most of y'all already know Dr. Escott, who serves as the Interim Medical Director and Health Authority for the City of Austin and for Travis County. And Dr. Hayden serves as a pulmonary and critical care physician in the ICUs of major hospitals here in Central Austin. She's also the assistant professor in the Department of Internal Medicine at Dell Medical School. We have seen a pattern where COVID cases increase significantly after holidays. And today we're in the middle of the holiday season, Christmas, Hanukkah, Kwanzaa, and leading into New Year's Eve. And our COVID numbers, deaths, and patients in ICUs continue to climb right here in Travis County. Unfortunately, we're getting dangerously close to hitting our ICU bed capacity, and the positivity rate is creeping up, particularly for the Latinx and African American communities. So we've asked all of you to sacrifice a lot this year already. I know that. And right now we're asking you to cancel your New Year's Eve celebrations, as this is not the time to gather with people outside of your home and with people who you don't live with in your home. The vaccine is just around the corner, and we must continue to stay vigilant and continue to save lives. And the most meaningful way to show the people that you love them is by staying home, wearing a mask, and washing your hands. And we're going to hear in a moment an update from Dr. Escott on the COVID numbers and where we are in Austin and Travis County. And then Dr. Hayden will share a little bit about her experience and what she's seeing in the ICUs here in Austin and Travis County. Normalmente cada martes el Dr. Escott proporciona una actualización del COVID-19 al Tribunal de Comisionados. Hoy no tenemos un tribunal de comisionados esta semana. Sé que todos confían en la información que se comparte para tomar decisiones. Es por eso que hoy, para brindar nuestra actualización del COVID del condado de Travis, me acompañan el Dr. Escott y el Dr. Shailaja Hayden. Muchas gracias por acompañarnos esta mañana. El Dr. Escott es el director médico y la autoridad de salud de la ciudad de Austin y el condado de Travis. Y la doctora Hayden es especialista en la unidad de cuidados intensivos en St. David's y profesor asistente en el Departamento de Medicina Interna de la Facultad de Medicina de Dell. Teniendo en cuenta el patrón que hemos visto que los casos del COVID-19 aumentan significativamente después de las vacaciones, nos estamos reuniendo hoy porque hoy enfrentamos el mayor desafío contra el COVID-19 hasta ahora. Desafortunadamente, nos estamos acercando peligrosamente a agotar nuestra capacidad de camas en la unidad de cuidados intensivos y la tasa de positividad está aumentando en nuestra comunidad. Les hemos pedido a todos que sacrifican mucho este año, pero ahora les pedimos que cancelan sus celebraciones del Año Nuevo, ya que no es el momento de reunirse con gente fuera de sus hogares. Aunque la vacuna está a la vuelta de la esquina, tenemos que asegurarnos de seguir estando atentos y de seguir salvando vidas. La forma más significativa de demostrarles cariño a las personas que ama es quedarse en casa. Escucharemos una actualización del Dr. Escott sobre los números de COVID-19 en el condado de Austin Travis, y la doctora Hayden compartirá lo que está viendo en el piso de la unidad de cuidados intensivos. So with that, Dr. Escott, I'll pass it on to you for your COVID update. Thank you for being here.
Thank you, Judge, and thanks everybody for joining us. I'm going to share my screen and give you our update. So, Judge, as you mentioned, things continue to worsen in Travis County. What I'm showing you here is an update of our new confirmed cases in the county. You can see that we're now averaging more than 400 cases on that 7-day moving average. You do see a dip from the past 7 days in those cases. And again, this is similar to what we saw the week of Thanksgiving, as people, in decreased numbers get tested. That has an impact on the cases detected. My expectation is that this number will climb significantly this week, and we will resume this upward trajectory that we saw leading up to Christmas. When we look at the impact on hospital admissions, again, the blue is the daily numbers, the yellow is the 7-day moving average. Once again, we see that those numbers continue to increase with us approaching our peak numbers from our surge over the summer. Again, this is particularly dangerous given that we have not yet seen the impact from Christmas yet, and we haven't seen the impact from New Year's. Looking at our projections from UT, that 1-2 punch of Christmas and New Year's is likely to lead us into a vertical trajectory, which means rapid growth in admissions to the hospital, and certainly also an impact on our ICUs in the next 2 weeks. This graph is showing 3 things, Judge. The blue is the total hospital beds being utilized for COVID-19 patients. The orange is the ICU beds. The gray are the ventilators being utilized. Again, we see the same upward trajectory of the hospital utilizations, now 422. Again, approaching the peak that we saw back in June and July already, before the impact from Christmas and New Year's. We saw a big jump in ICU use over the past week, and now we are, more than halfway into our total capacity for ICU's utilization for COVID-19 patients. Again, there are more ICU beds than the 200, but once we hit that 200, then it starts to impact our ability to care for other people who need ICUs. That would be people who have heart attacks or strokes, people who are in car accidents or have other traumatic injuries or medical ailments. Certainly the lesson learned from El Paso and Lubbock and Abilene and the other places that have faced a significant surge already is that once you run out of ICU beds, you run out of ICU beds for everybody. And that means that all these other people who need critical care will not have it because the hospitals are overwhelmed. Again, we have the space, we have the equipment. The challenge is the people, the doctors, the nurses, the respiratory technicians that we need to staff those additional beds. We don't have them, and the challenge, of course, is that right now Dallas and Fort Worth is surging, San Antonio is surging, Houston is surging, and certainly Austin is behind all of them in the magnitude of our surge. That creates significant concern that by the time we exceed capacity, the extra resources, the state resources in particular, will be consumed by those other metropolitan areas that are facing more significant and earlier surge. So again, I think we have to be careful right now. We have to re-energize that vigilance in our community so that we can avoid that overwhelming surge here that may impact our hospitals in the next 2 weeks. Judge, when we look at the updated projections from the UT Modeling Consortium, we can see that they are, day after day getting worse in terms of the outlook over the next several weeks. This is a projection of the moving average of new admissions. You can see that by the first week of January, it starts to go off the chart. So over 80 admissions on the moving average in a very short period of time. When we look at the ICU impacts over the next several weeks, again, it goes off the charts, and I zoomed out a little bit on this next view to give you some perspective on the scale of disaster that we're talking about. So the median projection now is that we will exceed capacity by January 6th or 7th. So we will be in excess of that 200 mark. By the 14th of January, that number of ICU beds needed is 300. A week later, it's 400. A week later, it's 500. This is massive and unsustainable growth. And again, when I spoke yesterday about entering the new year in a state of emergency, this is what I was talking about. Having an unprecedented surge here from COVID-19 at the same time that we are rolling out vaccinations. Again, this is not a future that will happen. This is a future that is most likely to happen if disease transmission stays the way it is today. But we can affect that, and we can affect that through our decisions to stay home and only go out if we have to. If we have to go to a grocery store, we send one person to the grocery store. If we can do curbside or delivery of groceries, even better. But it's about limiting the things that you can limit. And if you choose to go out, if you have to go out, wearing a mask and distancing at all times. The take-home message is at stage 5, looking at these projections, if you can't do something with a mask on and distanced, you shouldn't be doing it. And this is the kind of decisions that we need our community to make today in order to prevent this disaster from happening here. Again, this is what we saw in El Paso. It's not a theoretical possibility anymore. We've seen it happen in multiple jurisdictions in Texas, around the United States, and around the world. It will happen if we do not change our behavior. When we look at the impact of hospitalizations by age group, Judge, we can see that, again, that 80-plus age group in the orange continues to creep up. We did see a decrease in our percentage of individuals in the 70 to 79 age group, but an increase also in the 60 to 69 age group. I bring up these 3 age groups because they are most likely to need critical care. They are most likely to die from COVID-19. And when we see those numbers increasing in those age groups, it tells us that in the next week to 2 weeks, we can expect a significant increase in our deaths associated with COVID-19. We break that down by individuals hospitalized. Again, we can see we moved from 66 to 76 in that 80-plus age group, that 70, 79, 61 to 51, but a big increase in our 60 to 69 age group, 50 to 59. A total of 345 individuals in the MSA hospitalized last week, so a big jump from the 306 the week before. Again, we can see that in this light yellow color, our 20 to 29 age group, we've consistently admitted 21 to 22 individuals for the past 3 weeks. That tells us, because the risk of hospitalization is so low for this age group, that there is a massive amount of transmission happening in that 20 to 29 and the 30 to 39 age group. And it's particularly important for those groups to understand you can be hospitalized even though you're young. You can end up in critical care even though you're young. You can die even though you're young. We need to impact the transmission in those age groups in order to prevent better the transmission in the upper age groups, which tends to follow behind these transmissions in the younger age groups. We look at the impact on our community by race and ethnicity. We can see a decrease this week in terms of our Latinx community percentage of hospitalizations, a significant increase in our white non-Hispanic population, and a decrease in our African-American population that's in the gray line. Again, the COVID-19 pandemic continues to disproportionately impact our communities of color, and we will continue our efforts of outreach as we get into to vaccine. In particular, our APH vaccine strategy will focus on our communities of color and our low-income individuals who've also been disproportionately impacted by COVID-19. This is a graph, a breakdown of the number of hospitalizations by race and ethnicity. Again, relatively similar numbers of individuals hospitalized in our Latinx community, 109 2 weeks ago and 103 last week. a big increase in our white non-Hispanic population, 107 to 162. So this is not just affecting our communities of color, it's affecting our entire community. Again, this indicates to us that there's widespread, uncontrolled community transmission of COVID-19. And because of that, people need to assume when they leave their house and interact with other people, there is a risk of transmission wherever they go, whoever they're interacting with. Judge, unfortunately, our data for positivity continues to worsen. Last week, we're now reporting, and this is with more than 19,000 test results back, a positivity of 12.7%, which is a huge jump from the 9.8% the week prior to that. This is particularly concerning because the pattern that we've seen in the past is the positivity increases, meaning there's an increased number of cases, and the following week, we see the impact on the hospital system. So our guess is that this week, towards the end of the week, middle of the week, we're going to see big jumps in our hospitalizations and our ICU utilization based on this significant increase in positivity last week. Again, from the data that we're seeing so far this week, there's no indication that it's slowing down. In fact, the numbers of our the percentage on our internal testing continues to climb even as compared to last week. So there is concern that next week we could be 15% positivity or higher. We look at the impact of positivity on our races and ethnicities. We can see that our Latinx population in the gray line is over 20% or at 20%. African American community over 15%. Our Native Hawaiian or Pacific Islander over 15%. Everybody is well above the 5% mark, and obviously our goal of 3% is we're very far away from that. So again, we have to continue the efforts to decrease our risk when we're out, and that means everybody. That means not going out if you don't have to. This is the stage, if we have the ability to close things down, that this is the time that those discussions would be happening. But it's important that our community understands that this is a lockdown situation. These are the kind of numbers that we see when we would want to recommend a lockdown. We don't have to order that. People can choose to lock themselves down, to stay home, to make those decisions that are going to decrease transmission. And that's what we need people to do. When we see the impact of positivity by age group, Judge, unfortunately, the group leading the pack right now in terms of positivity is our 80+ age group, the group that is most likely to die from COVID-19. Remember that, according to our data, almost a third, so 1 in 3 of these individuals will die from COVID-19. The risk of death drops, the risk of hospitalization drops with a decrease in age, but I'm very concerned about the impact of this increased positivity, particularly on our upper age groups going into the rest of this week. We can see that we're continuing to see a significant impact on our nursing homes, 162 positive cases in the last 14 days, 380, 379 in the past 28 days. Again, the only way to really impact positivity in the nursing homes is to decrease positivity in the community, and that takes all of us. I want to mention our vaccine efforts, Judge. As you're aware, we are well underway in terms of our achieving our goal in A. So our hospitals have vaccinated most of the people who want to be vaccinated in the hospitals. We're working on, through our providers in the community, vaccinating other healthcare providers. And as Commissioner Hellerstedt released at the end of last week, we've also started vaccinating this 1B group, so our older population. What this means is that as vaccine is available, people in the 1B group, so those are people who are over the age of 65 or between 16 and 65 who have underlying health conditions, can get a vaccine. Now the numbers are still limited, but we are starting the process of getting some of those other individuals who are at higher risk vaccinated. This also includes the direct vaccination through our pharmacy partners, CVS and Walgreens, into our nursing homes and long-term care facilities. There's still a long road ahead of us in terms of vaccination, but we've been very pleased with the numbers of individuals who want to be vaccinated. Amongst our hospital staff, 85% or so have elected to get vaccination. When we look at our physician group, the numbers are even higher. 95, 96% of physicians want to get it as soon as they can. So again, this is our path out of this COVID-19 pandemic, and we'll continue those efforts to get folks vaccinated as quickly as we can. Again, Judge, we remain in stage 5 of our community-based risk guidance. That means people shouldn't gather outside of their home with people who live outside of their home. People should limit their travels outside of their home to those things which are essential. We want people to go to restaurants, but for takeaway or delivery only. We want people to go to retail if they need to, but takeaway and delivery only. People should be avoiding non-essential travel now. Even if they could travel safely in the past, as the disease transmission increases in the community, it increases the likelihood that that transmission will happen. The defenses become a lot more difficult when more people are capable of transmitting this disease. So again, we need to limit that risk as much as possible. And finally, Judge, I want to make some recommendations for our school systems. Again, with the positivity data that we're seeing and the impact on hospitalization admissions and our ICUs, it's time to scale back the risk. Again, the schools have done a great job at mitigating the risk, but as the positivity increases, we can expect that if we continue the way we have, that we're going to see increasing transmission associated with schools, particularly high schools and middle schools. So what we're recommending is that school systems suspend or postpone extracurricular and other activities on the school campuses where masking and distancing are not possible. Again, if you can't do it masked and distance, you shouldn't be doing it right now. For events that cannot be postponed or canceled, we're recommending that they significantly reduce the risk of transmission associated with those activities, and that they institute a proactive testing program for the participants so that we can quickly identify people who are positive and we can isolate them to prevent transmission in that extracurricular activity. We're recommending that middle schools and high schools transition to virtual learning for the 2 weeks following winter break. Again, to reduce the community risk and to reduce the risk of transmission within the school system. And finally, for any student or staff member who traveled during the holiday or were involved in a social gathering, we recommend that they get proactive testing, even if they're asymptomatic, 7 days following the gathering or travel to further help us limit the risk of spreading to other people. With that, Judge, I'll pass it back to you.
Thanks, Dr. Escott. Up next, Dr. Hayden, if you have a moment, could you tell us what are you seeing there in the ICUs in Austin and Travis County?
Yeah, thank you for having me here today and giving me this platform to speak directly to our community. You know, I think I speak for all of our staff here in the ICU, the nurses, the respiratory therapists, PT, OT, social work. I mean, everybody who comes together to take care of the sickest COVID-19 patients, in saying that we are tired. We are emotionally and physically tired. And seeing the projections that Dr. Escott just showed us is chilling to me. I feel like we are working basically at capacity. We are working hard, and the idea that numbers could increase exponentially is really daunting. I was involved with taking care of the first patient diagnosed with COVID-19 here in the Austin area back in the middle of March. And pretty much every single day since then, I have either taken care of COVID patients, mourned for COVID patients that we have lost, planned and prepared our hospital systems and ICUs and worried about this nightmare scenario in which we truly are overwhelmed and unable to provide the usual excellent standard of care that we strive to give to everybody. Right now, I'm sitting in an empty patient room, and I sit here with sadness because the reason this room is empty is the patient who has been in here for the past 6 weeks fighting for her life, unfortunately, has passed away. And without violating her privacy, I'll say that this patient was actually someone who transferred to us from a town in West Texas because they were overwhelmed and had no ICU capacity to take care of her. And so, at great risk to her own life, we put this unstable patient in a chopper and flew her hundreds of miles away from her family and support. And that's something that I don't want to see happening here in Austin. And as Dr. Escott said, since all of our surrounding metro regions are also in bad shape, there may be nowhere to transport anybody. And we may wind up in a position where we're having to use less experienced staff in makeshift rooms. And that's a nightmare none of us want to come to. But we do have the power to affect this trajectory and to slow the spread of this disease. And I would plead with everyone in our community to do the things that Judge Brown and Dr. Escott just mentioned, to stay home when you can, to wear a mask when you can't, to stay distanced from people, to wash your hands, to do everything we can to protect ourselves, our families, and our entire communities. You know, what we're seeing is like a house fire. I mean, the suffering, the magnitude of suffering in the ICU right now is like nothing I have experienced before, in that entire families are being ravaged at the same time by this disease. We've had so many instances where husband and wife, or multiple generations, father, son, siblings, are all in the hospital at the same time, and alone. You know, being a COVID patient is an experience I would wish upon nobody, in that there is a lot of suffering. People are short of breath, they're frightened, they're uncomfortable, they're on life support machines, and they're going through all of this by themselves because their family is often not allowed to visit for the protection of everybody involved. Sometimes their families are in other hospitals fighting for their own lives. And seeing these patients suffering and lonely is a hard thing, I think, for all of us who work here. And many, many times hearing from family members who think that they started that fire, that they were the one who potentially brought COVID home to their family, the guilt and grief in that belief. And most of the time, we'll never know for sure who brought it to whom. But I do know that those people will live with that guilt the rest of their lives, that their decision to attend that wedding or get dinner with a friend or grab that beer or whatever the decision may have been, may have led to the severe suffering and death of their loved ones. I'm glad Dr. Escott brought up the fact that even very young people are being hospitalized. To the young people out there, your chances of surviving COVID-19 are really, really good, but there is still a chance you could have a hellish journey in the hospital before you recover that will change your life forever. And I'll say that the youngest patient that I have personally lost to COVID-19 was 25 years old. And that's not something I ever want to see again. And so I would really, put out a plea to the young people that a virtual holiday celebration is kind of lame, but a virtual funeral is heartbreak. And so to do what you can to, again, protect not only yourself, but your mom or somebody else's mom out there in the community who may not be able to withstand this disease.
Thank you so much, Dr. Hayden. Dr. Escott, one of the things you mentioned was the UT model and how it projects us, things getting much worse in the ICU and the numbers really increasing there. Can you say a little bit more about what that means? Like what is the UT model, or what's it telling us?
So the UT model takes into consideration the admissions to the hospital, the daily numbers, as well as mobility data. And basically what this is doing is giving us potential future possibilities of what the disease trend is going to look like if disease transmission stays as it has been. And that median prediction, that blue line that you saw, is what we call the best guess. And that's sort of the average of all the predictions. And right now it is becoming a vertical line. It's becoming an exponential graph. And this is something that leads to unsustainable growth, and it's rapid. And this is what we saw in Wuhan. This is what we saw in New York. This is what we saw on the West Coast early on in the pandemic. Is hospitals will go from being kind of full and okay to completely overwhelmed in a period of a few days. That's how quickly it changes. And what we found is that when communities respond after that happens, after the hospitals are already full, it takes weeks to come down from that. And what we also know, as Dr. Hayden mentioned, is that care suffers. You can't possibly care for that. You can't possibly care for 500 intensive care patients as well as you can for 100 or 200. And what we see in all those places that have experienced that is the death rate goes up substantially. Sometimes triple the case fatality rate in those circumstances. So it is serious, and we have to act now. We're running out of time.
Thanks. Dr. Hayden, why would someone be in the ICU? What does COVID do to your body that would make you go into the ICU?
COVID has a lot of different effects on the body, and we're still learning about many of those. But the most common and the most dangerous is that it causes pneumonia, so inflammation within the lungs, or a viral infection in the lungs. And that makes it so that a person can't keep their oxygen levels up. And some of those people feel extremely short of breath, that they're gasping and feel like they're suffocating. There are some patients whose oxygen levels are life-threateningly low, but actually don't feel that bad. And in a sense, those are even scarier patients, because many of them stay home not realizing how sick they are until it's really reached a crisis level. But our patients in the ICU are typically here mostly for the breathing complications of COVID. We're also seeing COVID triggering heart attacks and strokes and other reasons to be in ICU. Once a patient is in ICU, many of them require various forms of life support. Most commonly a ventilator, which is a machine attached to you through a plastic tube that goes down your mouth into your throat that helps you breathe while your lungs are unable to breathe because of the COVID pneumonia. Being on a ventilator is a terrible experience, and it's worth it to some patients who may be able to survive because of that. But even for the survivors, their lives are changed, that they've had to spend weeks and often months in the hospital or in rehab, recovering their ability to move and to walk and regain their strength, to relearn to swallow and talk and all of those basic functions. And so I really want to emphasize that it's not only the death rate, which is horrifying, but it's the number of people who have had to go through incredible amounts of suffering to survive. And thank God they did survive, but their lives will be forever changed.
Thanks. We got a question here from, looks like Brad Swale. He says, why encourage healthy people to quarantine, especially with recent studies that show that asymptomatic spread occurs, if at all, extremely rarely? I don't know. Dr. Escott, you want to take that one first?
Yeah, so there's asymptomatic spread, and then there's pre-symptomatic spread. So asymptomatic spread, when we refer to that, we mean people who never develop symptoms. What's more common, much more common, is that people have an asymptomatic period, and then they develop symptoms. It's during that period of time when they don't have symptoms yet, and when the symptoms are the most mild. So mild sore throat, a runny nose, a mild cough, things which look like a common cold. That's the time when they are most contagious. And that's the dangerous part, because you don't look at somebody and say, oh, that person's got COVID. I'm in danger of getting it from them. they look relatively healthy. And, there's a false sense of security in those circumstances that is leading to people taking off their masks and having a drink or having a meal with that individual that is leading to transmission.
Thanks. We're getting some questions about vaccine access too. Or I'm sorry, Dr. Hayden, did you want to add anything to that question about spread? Okay.
Agree with that.
All right. So when and where will the vaccine be given to those who are 75 and older? And then asking about teachers, when would they get it? And then another question about what are the high-risk medical conditions that would make someone under 65 eligible for the vaccine? Dr. Escott, you want to?
Yeah, sure. So the question regarding individuals over the age of 65, that's our 1B group. So it's that group as well as people with underlying health conditions. The directive from the Commissioner of Health, John Hellerstedt, is that if there's a vaccine available right now and providers are looking for people, they don't have to wait on the 1A group to be completed before they move on to the 1B group. So we don't have to have all the healthcare providers vaccinated before the other group starts theirs. So what we're seeing now is that some of those providers are starting to offer those to individuals within those groups. We can expect over the next couple of weeks for those numbers to increase. Right now, a lot of them are still what we call closed pods. So these will be our hospitals, for instance, that are focused on vaccinating their personnel. But if they have additional vaccine in excess of what they need for their personnel, they may start offering it to some patients. My best advice, and the advice that I gave to my folks and my in-laws, is look at the list provided by DSHS of providers in your area and call them and get on the list. For them, it was Randall's. They live in Houston. Locally, every HEB in Travis County, I believe, has been allocated some vaccine. So call your local HEB. There's other providers on the list, and they will notify you when it's available for you. Regarding the high-risk conditions, there's a long list. It's things like heart disease, sickle cell, underlying lung conditions. There's a whole host of things on there. You can go to our COVID-19 website at austintexas.gov/COVID-19 for a link to those underlying health conditions.
Thanks. And then is there a category for teachers? Are they in a specific category?
So there's not a specific category for teachers or other essential workers. And the reason is that the state has identified and correctly that the risk is really based upon age and those underlying health conditions. So we are going to, Austin Public Health, for instance, is going to focus our vaccine effort on our communities of color and our low-income individuals that fit within that 1B group now, and then after that into the phase 2 group. But we may see that TEA or DSHS or other groups have specific allocations for teachers. But again, like other individuals, teachers are not at uniform risk for severe disease. So certainly when we talk about vaccinating teachers, those who are over 65, those with underlying health conditions really do need to get it as soon as possible. Younger and healthier folks need to be patient and understand that their turn too will come in the coming weeks.
Thanks. Lori Lopez I'm sorry, go ahead.
Add one thing to that, when your turn comes and a vaccine is available for you, please take your vaccine. It is our ticket past this pandemic. It is effective. It is safe. I have taken my first dose myself. Almost all of my friends and colleagues in healthcare have taken their first dose. I will absolutely recommend to my own husband and parents and extended family that they all get their vaccine when available.
Thank you. And Dr. Escott, I think I saw a picture of you also getting the vaccine.
Yes, it's next week. I'm due for my second dose. Again, none of the healthcare providers that I know have elected not to get it. It's uniform, and I think it's great for our healthcare providers to set that example and share the trust in the vaccine. It is a fantastic vaccine, and I agree with Dr. Hayden. When your time has come, you should take it as quickly as possible.
I think we have time for one more question. This one's from Lori Lopez. She says, since the governor is not willing to close bars, restaurants, and schools, how do we enforce masks and social distancing?
So again, the masking is enforceable in multiple different locations, including restaurants and restaurants that really are bars, but allowed to be open through loopholes. We have been increasing enforcement activities through our Austin Public Health, through our code department, through the fire marshal's office. Those activities will continue to increase to ensure that those public places are as safe as they can be. But ultimately, the best way to make those places safe is to not go there in person, to do takeaway or delivery only. There is no risk no substantial risk if you go in and pick something up or have it delivered. So my best advice to the community is choose curbside or delivery only for now. We are still looking at later this week and the concern regarding New Year's Eve and bar activities. And I expect that we will take further action to help mitigate that risk, but still in those discussions.
And I know you and I and others have been talking about curfews. We got a question here about whether it's an option still. I know we're looking at any way that we can to get those numbers down. Do you have anything you'd like to say about curfews or those efforts, Dr. Escott?
Yeah, Judge, again, I think what we're facing Thursday, Friday, Saturday in particular is a risk that we simply cannot take right now. We have the projections based on what we're already seeing. If we take individuals who were exposed during Christmas gatherings and put them in bars on New Year's Eve and pack them together for hours, the projection is going to be overwhelming, and it's going to happen very, very quickly. I do not think we can afford to take that risk. So I think we have no other choice right now than to take action to prevent that from happening.
Thank you. Dr. Hayden, thank you so much for joining us. And I just want to give you a chance, if you'd like to say anything else to the people out there from the perspective of your position as a doctor in the ICUs here in Austin.
Again, I just want to plead with everyone in the community to make smart choices, keep yourselves safe, keep your families and our community safe. We do have the power to affect this trajectory, and I think it's really our individual duty to do that.
Thank you. Thank you so much for joining us, and I hope in the coming weeks, as we need more updates, you'd be able to join us again. Dr. Escott, any last words before we head out?
Judge, I just want to echo Dr. Hayden's comments, and it is about our choices. And I think one of the universal truths that span religion and time is that we have a duty and obligation to serve one another, to protect one another, to love one another. We need that right now. We are running out of options, and things are about to get dire. So we do need people now more than ever to take action to prevent that from happening.
All right, sounds good. All right, folks, please listen to these two doctors. Listen to me. Listen to everybody who's saying, please wear a mask. Don't go out on New Year's Eve around people and be around people who you don't live with. That's a very important ask that we're making of you right now. Thanks. I know there have been a lot of sacrifices by our entire community throughout this process. There is a light at the end of the tunnel. The vaccines are coming, but we still need to make some more sacrifices and stay safe to save lives over the next several weeks. So thank you so much. And we will see you next time.